Let's look at the role of kinesiology taping in prenatal diastasis recti. First question is, what is diastasis rectus abdominis? This is where we have a stretching of the abdominal wall and the connective tissue or aponeurosis at the midline, the linea alba. This is a natural part of pregnancy, and by the end of all pregnancies, this separation occurs. But sometimes DRA can happen quite early in the pregnancy, and this can come with some symptoms. For example, pain, difficulty moving and transferring load. And this can be quite uncomfortable for the client who has a long way to go through the pregnancy. So if we look at the muscles of the trunk, I like this picture because it peels back the layers. We're not just talking about the rectus abdominis. The transversus abdominis and the obliques all blend and marry at this linea alba. So depending on the extent of the diastasis, this can be separation through all layers of the abdominal wall. If we look at rectus abdominis, which is the most superficial, and its origin and insertion, it originates at the crest of the pubis, and it inserts at the costal cartilage of ribs 5 to 7 and the xiphoid process of the sternum. Its action is lumbar flexion. If you look at this illustration to the right, you will see how the fibers of things like the obliques blend into the rectus abdominis and meet at the linea alba as well. So sometimes stimulating rectus abdominis can help in terms of diastasis, pain and discomfort, especially where the client has this pain or discomfort on movement or transferring load, but it's certainly not the answer to the issue. There are many treatment considerations for clients with diastasis. You may want to engage the rectus abdominis if assessments suggest that might be helpful, and that gentle core activation helps relieve some of the client's painful symptoms. Providing some support to the linea alba itself can improve the comfort level for the client. But remember, assess globally. For example, are overactive obliques playing a part, or lumbar lordosis? And will soft tissue release help with recruitment of the abdominals or relieving some of the pain symptoms for the client? Consider the activities of daily life for your client. Are they picking up a toddler? Do they sit a lot? What activities are they doing that might be aggravating the pain that they feel or some of the symptoms rather than the diastasis itself? This really is a multifactorial issue. And again, taping is not going to close that separation at the midline. Indeed, it's a natural process as part of the pregnancy. But if we can use tape to help alleviate some of the symptoms where clients are feeling pain, discomfort, or problems moving, then it might be a worthwhile addition to your treatment planning. Note that treating a pregnant client is contraindicated unless you are qualified to do so. And if you are qualified in treating pregnant clients, then taping is a very useful tool to assist as part of your treatment planning. So let's take a look at the taping itself. We are going to look to apply a two-step taping today. We're going to look at activating the rectus abdominis, and we're also going to look at a mechanical or supportive taping across the linea alba to help improve the client's comfort level. Other taping options are potentially inhibiting the obliques if you think and on assessment you feel overactive obliques are playing a part in the diastasis of this client. So as always, simply integrate into your overall treatment plan post-assessment. Let's take a look. Firstly, we want to activate the rectus abdominis. So it's an activation, so we're going to tape towards the origin, which is at the pubis. So anchor the tape with no tension at all. Peel back the tape and add a light amount of stretch to the tape and ask your client to come into hip extension, so putting the tissue on a little stretch. Rub the tape well down to stick, and then ask your client to just anchor the tape at the ribs, so at the insertion. We're going to repeat this on both sides. So again, we're going to anchor at the origin, so towards the pubis. We're then going to peel back the tape, add a light amount of stretch to the tape, bring our client into hip extension, so a little stretch, and rub the tape well down to stick. anchoring with no tension and no stretch. Next up is the mechanical support of the linea alba. So usually with the mechanical taping, we would apply a heavy amount of stretch. But in the case of the pregnant client, we don't want to do this. It's important that the growing belly has room, and our intention really here is just to alleviate some of the discomfort over that midline region. So I'm going to anchor the tape to one side of rectus abdominis, ask the client to hug the baby, so to bring the line together, and then I'm going to add just a light to medium amount of stretch over that tape. It must be comfortable for the client. So again, watching, anchor to one side. Now ask the client to hug the baby, so they're going to engage those abdominals, closing the line. A light to medium amount of stretch over the line and anchoring with no tension. And this can be repeated or done simply at the widest part of the diastasis, for example, if it's only just above umbilicus or just below, or if it's wider or from top to bottom, you might want to repeat this down the whole length of the linea alba. But again, although it's mechanical, we only want to add a light to medium amount of stretch on the tissue. And the real indicator here is if it feels comfortable to your client. So anchor with no tension, client hug the baby, light to medium stretch, and cross the midline, rubbing well to stick. Okay, and then we can also do this below the belly button. I tend to avoid the umbilicus because it can be uncomfortable, especially if the client's belly button is protruding. But again, be guided by your client. If that's where their gap is the widest or where they have the most discomfort, then applying a piece of tape with light pressure over that area might be completely indicated. So once again, anchor to one side, peel back the active portion of the tape, light to medium stretch, hug the baby, and closing to the other side.